So I'm joined by.
Almothana Manasrah. I'm an internal medicine physician practicing in United Health Services, Wholesome Medical Center.
Nice to meet you.
Nice to meet you as well.
And thanks for coming on this podcast. So I have a couple of questions for you. My first one is, what made you choose internal medicine and what keeps you passionate about it?
So internal medicine is one of the specialties that has it's the bread and butter of medicine. You are able to care for every patient, in different level of acuity. So this make you always, engaged rather than dueling with one subspecialty where you only focus on the care of a single entity of patient. So during my journey in internal medicine, I was able to help different people from different backgrounds with different conditions. So this is what I really like about internal medicine.
So basically what you're saying is you get to see a broad range of diseases and injuries, and then on top of that, a diverse range of patients that come to your practice.
It's 100% correct. It's one of the most amazing specialties. If you think about it, everything lies about medicine. This is where you start. All other services are actually helping us care for the patient. We are always primary. We are always the team responsible for the patient directly. We get to know them on a personal level. So, which is really amazing.
That's awesome. And that's a very nice way to look at it, especially being in the United States, you have a huge diverse background here and a lot of different conditions and a lot of different types of patients that probably come into your practice. So my next question is, what are qualities of a great internal medicine physician?
Again, going back to my first point, we care for a diverse population, we care for diverse patient conditions. So the most important thing is taking a step back and take a look at the patient as a whole, not as one disease, because what can work for one patient is different from another. There are some medication that can injure the kidneys, but at the same time help the heart. If you have bad kidneys, you need to address that. So this is one of the most interesting parts of internal medicine. If you are able to look at the patient as a whole rather than just addressing one issue, I believe this will set you apart between your peers.
That's awesome. I think holistic medicine is definitely the way to go. Especially like you said, you don't want to look at one particular illness or injury, but you want to see the patient as a whole and their well-being. So my next question is, what are the most common mistakes that you see beginners do in your practice?
This is a very interesting question. I really like it. Actually, this is a mistake that I have fallen myself, is focusing more on the practice and studying and forgetting about yourself. I believe the way to provide best care to patients is by caring for yourself. Take the time to take a breath. Don't bury yourself with studying, being in the hospital. I know our shifts can be busy and our job is very demanding, but you need to prioritize yourself as well. Go to the gym, be active outside of the hospital, because if you just if you focus on caring for patients, and again, I'm not saying forget about your job and taking care of patients, but give yourself a breath as well. Because if you only focus on caring for patient and you forget about yourself, you're gonna end up a patient yourself.
That definitely makes sense. Would you say that there's a huge risk for burnout for beginners?
Definitely there is, and I have experienced it myself during my first 2 years of residency. I wasn't taking good care of myself. I was not focusing on my diet, on my exercise. So I was actually being burnt out. Then I decided that I'm gonna start going to the gym, go on more hikes, doing more things that I actually like. And since then, I found a very good balance, and I'm much more happier now.
Definitely. That definitely resonates with a lot of careers, I would say. A lot of careers end up in their beginner stages. What they will do is they will focus entirely on their career and then neglect everything else, like their diet, their exercise, and then all of that goes to waste. And then along with that, your career also starts to deteriorate. So definitely. Now, my next question is, with all the advancements in technology and the advancements in healthcare and medicine, how do you see that impacting internal medicine?
So I believe a huge change now is AI in the field of medicine. We have seen it impacting the diagnostics parts of medicine, like pathology, radiology. Like AI machines are able to detect diseases, and there have been studies that they are able to detect diseases sometimes better than the physicians themselves. But for me personally, like in internal medicine specifically, because you are providing care to a human, and there's nothing in this world that can replace the human interaction. Like the type of comfort you get from understanding and realizing that there's someone caring for you and who's willing to go over and beyond to help you. I believe this is the part where we cannot replace by these advancements. Also, we have been seeing a lot of technology being introduced, like from very advanced imaging modalities, very advanced treatment and therapeutics, gene therapy. I believe this is, if anything, it's helped us to provide better care for our patients. A way that I keep updated with these things is by being like focus on one journal and start reading from that and make like this journal your new Bible.
So which medical specialty would you say is at highest risk of being replaced by AI?
Well, that's a very interesting question. I don't think there is any specialty that can be completely replaced by AI, but the specialties that will be most impacted by AI are the ones who depends on interpreting imaging, just like pathology, radiology. These specialties will be impacted in a higher way than other specialties.
That's pretty interesting. And a lot of people have questions about that. Now, obviously, nothing can replace a medical doctor, as you said. But how do you think the integration of AI will go into, for example, radiology or pathology? Do you think there'll be one radiologist who supervises the AI, or will it be AI supervisor with radiologists working underneath them? But how do you think the structure will look like?
I believe it's most likely gonna decrease their workload. They're gonna provide them with the AI machines that's gonna read the imaging and then provide them with the results so they can supervise and proofread the reading. This is my belief. I have yet seen nothing happening right now, but I believe this is one of the biggest changes that will be coming.
Okay. And my last question for you is, what advice would you give to somebody who wants to pursue medicine as a career?
I would say if you want to pursue medicine as a career, just be humble, be consistent. Consistency is the key. And the reason why you will have challenging facing you, just like in any other career. So whenever you have a challenge that face you, you want to be like consistent to be able to overcome it. And it takes a lot of you to keep up with all these changes that is continuously happening. So just be consistent.
Okay, perfect. That's all the questions I have.